Hi, and welcome to Open, the show that opens the Bronx and the rest of the world to you. I'm Kibin Alleyne, and today we'll update you on what's happening in and around our borough. Coming up, the annual election period for Medicare begins on October 15th and runs through December 7th. We speak with a rep from Elderplan / HomeFirst to get all the information. Then a breast medical oncologist from MSKCC speaks about raising awareness in the Hispanic community about the importance of routine screenings. After that, we speak with the owner of Cupcake Me about the struggles of being a small business owner. Later on, we speak with two representatives from BronxWorks about their upcoming event on October 19th at Orchard Beach. And finally, the CEO of Oliver Scholars tells us more about how their program helps prepares high-achieving Black and Latinx students in New York City. So stay tuned to all this and much more is headed your way because we're now officially open. Hello everyone, I'm Kibin Alleyne, and today is Tuesday, October 15th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. Starting today until December 7th, Medicare beneficiaries can change their Medicare coverage. Senior Vice President for Growth and Business Development at Elderplan / HomeFirst, Frank Polanco, joins me to discuss what to consider when making decisions about Medicare coverage. Frank, thank you so much for joining me.
Oh, thank you for having me. This is so exciting. Thank you, Kevin. Nice meeting you.
Nice meeting you as well. Now, I want to say that Medicare can be very confusing. I know it is for me, and I know it's confusing for a lot of people. So I'm glad that we have you here on the show to kind of explain it all to us. To start, can you explain to viewers, what that is and who is eligible for it?
It's very exciting, very important time. In our community in New York, we have 4 million seniors enrolled in Medicare. Right now is the opportunity that they have from October 15th to December 7th to make a change in how they receive their Medicare. So it's very important. We'd like everybody to, we say reflect, research, and enroll, to think about their current situation, how it may have changed, to research all the available plans in the market, and to make a decision by December 7th.
Now, I understand there are different parts, Part A, B, C, and D. Can you explain what that means?
It's pretty complicated, but I mean, the most important thing is that most folks, when they turn 65 in general, become eligible for Medicare. Historically, there was Part A, Part B, and Part D. Part A generally covered hospital, Part B was generally for doctors, and Part D was for prescription drugs. Recent times, we added a Part C, which added Medicare Advantage, which is what we do at Elderplan. We're a not-for-profit organization that does Medicare Advantage plans in the Bronx and in the surrounding area.
Now, for our eligible viewers, can you give us the basics on the Medicare Annual Election Period? I know that is something that happens all the time. Can you just further explain why it's so important that people kind of remember that this is a time period where they should be paying attention to?
It's actually more important this year than in past years, because this year, for the first time, the government made a change limiting the opportunity for some of our seniors to make changes to how they receive their Medicare. But in general, it is the one opportunity a year that seniors have to change the way they receive their Medicare, to make a change to the way they receive their Medicare Advantage. So when things change, and things do, personal situations change, maybe a new doctor, maybe a new prescription drug, maybe your health plan has changed their benefits. They do, they change every single year. So it's a really important time, like I said previously, to reflect, research, and please make sure that you make a decision or decide to keep what you have by December 7th.
Now, what should people consider when choosing a health plan?
Absolutely, that's a big question. It should always be about your personal situation. What has changed? Like, do you have a new drug? Do you have the need for a new benefit? People talk about OTC cards. People talk about transportation. What has changed in your life? And what has changed in the market? Sometimes plans leave service areas. They might decide to leave the Bronx. They might decide to leave Manhattan. Is your plan staying in the service area? Those are some of the important inflection points that you should have when you decide on a plan.
Now, I understand that even if you're already enrolled, this is still something that you should pay attention to. If you are enrolled, what should you do?
If you are enrolled,
Yeah.
if you are enrolled, you should make sure that the plan that you've had for years servicing you is still servicing you the way that you need to be serviced. If you have changes, make sure that there aren't other plans out there in the community which might offer you better service. You can come to elderplan.org. We have benefit advisors that will come out, they'll speak your language and help you understand the offerings in the market and help you enroll if that's what makes sense for you.
And I also wanted to expand on that because, as we mentioned in the beginning, this is a very confusing time.
Yes.
It can also be very overwhelming
Yes.
to have to think about your health, what you need, and to kind of read through all that stuff. What are some services out there that can help people kind of walk them through the changes that they need to look out for?
Well, I will say that Medicare has an awesome resource, medicare.gov and cms.gov, also by the government. They list all the plans and all the different offerings and have a lot of great information. And I would say that elderplan.org is also a terrific site with a lot of information about different Medicare Advantage plans. And we will send someone out to your home to meet with you, to explain everything to you and help you make decisions and help you understand your options.
Now, what could possibly happen if a viewer makes a change during the annual election period, but doesn't like maybe the change that they made or they regret it? Is there a second chance? Is there an opportunity? Okay,
No,
good.
I'm kidding. No, there absolutely is an opportunity. If on January 1st, when you have your new health plan, you decide that, oh no, I made a mistake or I didn't consider this, you will have an opportunity to change. It's called the open enrollment period. It starts on January 1st and it ends on March 31st. So there will be an opportunity. If you made a decision during the annual election period that you did not like, you can make a change.
That's
you
amazing.
won't be stuck.
Okay, okay, that's really great news to hear. Now, I want to talk about the importance of this because as we are focusing on seniors, we know that a lot is at risk when it comes to the resources available to them. Can you just explain why it's so important that, not only people who are seniors, but people who care for seniors, maybe it's a grandma or a parent, why we should kind of be involved in this process, or if we can help them with this as well?
I'll give you an example, a real example. I received a phone call. A gentleman's mother just realized that the plan that his mother was in was leaving the borough that they were in, and the whole family was concerned because this could possibly uproot where the mother would be able to go to the doctor, what her copays would be, how she would access her prescription drugs. So it's a major concern, not just for the seniors, but for their family members, for their sons and for their daughters. It's always important. So please, I would just ask everyone, reflect, research, and make sure you make a decision by December 7th.
And where can people go to learn more, about making the right decisions? I know we talked a little bit about it now, but of course, if they don't have the time right now and they want to, save it, because, we do have a little bit of time until December 7th.
We do.
Where can people go to learn more information?
Elderplan.org, cms.gov, medicare.gov, and Elderplan would love, to be able to help you in this decision. We will send benefit advisors out. We speak your language. We have all the documents in different languages, Spanish, Chinese, Russian, and we can give you all the information to help you make a good decision during the annual election period.
And while we're here, we didn't get to touch on it in the beginning, but can you tell us a little bit more about Elderplan, the organization and the work that you do?
Elderplan is a 40-year-old Medicare Advantage plan. We have a managed long-term care plan called HomeFirst also. We service, it's just a coincidence, but 40,000 members now, which is kind of cool. It's a milestone that we just hit, so we're very excited. We serve the communities of the 5 boroughs, and we go a little north and a little east. We go to Nassau and Westchester, but we're in the community. We have many representatives in the community talking directly to our potential members, and we're excited to speak to the community every day.
Well, that's amazing, and I want to thank you so much for joining us. I know just through this work that I've been doing that sometimes the senior community or the elder community is often overlooked and often doesn't get the resources that they deserve. So it's great to see that there are organizations out there doing the work to help elders feel visible and just letting them know these are the things that are in place to help them protect their health and and their families and all that. So with that, I want to thank you so much for joining us and kind of educating our viewers about what to do. And again, that's on December 7th.
It ends on December
Ends
7th.
on December 7th.
Enroll, reflect, research, and enroll.
Okay, well, once again, thank you so much for joining me.
Thank you, Kibin. It's my pleasure.
For more information on the Medicare Annual Election Period, please go to the website medicare.gov. Don't go away, we'll be back with more Open right after this.
Only 57% of New York City high school students are college ready by their senior year. "55% of high school graduates either have no plans to attend college or are uncertain that they will ever attend. "34% of young adults don't go to college because they can't afford it. Discover what's possible. BronxNet's education programs, internships, and opportunities help engage and inspire Bronx youth and beyond to pursue their passions. Be a part of the BronxNet family. Whether you're interested in our shows, joining a class, or donating to support our mission, visit BronxNet.org to learn more.
Welcome back. Created to raise awareness about the importance of routine screenings in the Hispanic community, MSKCC created the Get Checked A Tiempo campaign. The initiative aims to shift the conversation around cancer from one of fear and stigma to one of empowerment and proactive health management. Let's take a look at one of the PSAs created for this campaign.
I may not always love you, but as long as there are stars above you, you'll never need to doubt it. I'll make you so sure about it. God only knows what I'd be without you.
I'm too late.
Breast medical oncologist for MSKCC, Dr. Pamela Drullinsky, joins me to discuss. Doctor, thank you so much for joining me.
Thank you so much for having me.
One, I just want to say, this is such an important discussion that we're about to have because I understand, it's talking about a vulnerable community. Can you tell us a little bit more about the work before we talk about the campaign, the work that you're doing? I understand that you're also a director in this as well. Can you tell us a little bit more about that?
Yeah. So the Ralph Lauren Foundation has been around Harlem for about over 20 years now. But Memorial Sloan Kettering Cancer Center partnered with the Ralph Lauren Foundation over 5 years ago to really improve cancer care in Harlem and the South Bronx community. And I'm so glad to be here so that we can spread the word.
That's amazing. Now, I want to talk about Get Checked A Tiempo campaign. Can you tell us the primary goal of this campaign and how it began?
Yeah. So Get Checked A Tiempo means on time, and right away. So we really want to encourage women to get their breast cancer screening. Breast cancer screening is very important. The earlier we pick up breast cancer, the more curable it is, and mammograms are recommended for women beginning age 40. And unfortunately, so many of us are not going to get their mammograms.
Now, how does the campaign address the unique challenges the Hispanic community faces regarding health screenings? Because I definitely want to emphasize that, there's an effort to reach the Hispanic community. So, what are some of the challenges this community faces?
Yeah. So I think there's a lot of fear for women. We hide breast masses. I can tell you as a medical oncologist over 30 years at Memorial, lately we've been seeing more and more stage 4 patients, and women are just not bringing that to attention. So there's fear, there's misinformation. Even with insurance, only about 70% of women are getting their mammograms, and without insurance, the numbers go down to 40%. So one of the things I wanted to mention is that with MSK RLC in Harlem, there is a fantastic program from New York State. It's called the CSP, the Cancer Services Program, where women can get mammograms for free. and you don't even need insurance. You can come in without a prescription, without insurance, and if you qualify, you can see a nurse practitioner and get your mammogram same day.
That's amazing. And then I understand that you, can you also translate that message to our Hispanic viewers so they can understand? Because I think that's very important information.
Okay. Thank you. I definitely want to say it in Spanish. So, lo que quería decir es que sin seguro uno puede tener una mamografía en Memorial Sloan Kettering RLC, que está localizado en la 124 con Madison. Y si tú tienes una masa o un problema, nosotros nos podemos ver sin seguro y sin ver un médico.
Thank you so much for that. Now, how can we use this campaign to change the narrative from fear to one of empowerment?
So I think we need to get the message out that breast cancer is highly, highly curable. Just repeating that it's over 90% curable when picked up in stage 1 or stage 0, which is pre-cancer. So there's no reason for us to neglect ourselves. The other thing is that women fear the pain of mammograms, but it's really only for a few seconds that it's uncomfortable. So there's no reason not to get a mammogram.
Now, what specific barriers could be facing the Hispanic community that may lead to this delay or avoidance of routine screenings?
Yeah, I think part of it is there could be a language barrier. Luckily, in New York, we have most things in English and Spanish. Also, most facilities have Spanish speakers. If not, we have interpreters. And I think also lack of insurance. So I just want to stress that New York State has wonderful services for people without insurance.
Now, how can community leaders and healthcare providers collaborate to improve access to routine screenings for Hispanic populations?
So I think one of this is this program and the awareness. I think the October Breast Cancer Awareness is extremely important, and Memorial Sloan Kettering is right here in Harlem and the South Bronx to help this community and spread the word.
Now, what role does education play in the Get Checked A Tiempo campaign?
Yes. So I think that unfortunately with the pandemic and the internet, there's been a lot of misinformation, which we're trying to break those barriers. Cancer is very, very scary, and a lot of times people fear the medication more than the diagnosis. So we're trying to say that there's so many treatments available, there's no reason not to see a physician.
And I also want to talk about the importance of representation. I know we talk about it in other areas, but can you talk about how being represented in the doctor's room, having somebody there who understands you or can advocate for you, can be very helpful?
Yeah. So, luckily a lot of women are in medicine now, including myself. And so I think gynecologists, internists, women shouldn't be afraid to speak to their practitioners. And as a woman, my family is from Chile. There's a lot of us who do speak Spanish and understand the Hispanic community. And we just come and see a physician, see a nurse practitioner, and we can help you. So don't ignore your symptoms.
Now, what are some ways that, not only the patient, but, everyone, our entire society can kind of step away and understand that there is a stigma, and what can we do to kind of end that stigma surrounding not only just cancer, but any, sickness?
Yeah, no, I think it's a great question. And I think, again, going back to the misinformation, I think science is people don't value it as much as before. And I think we need to begin to trust our professionals who studied, who work in this, and seek help. And I think, especially with breast cancer, as an oncologist, I don't even understand it. Women are just embarrassed to bring up a mass or a symptom, and we're just not reaching out enough. So I'm glad that we're doing this, and hopefully we're reaching more women.
Now, how can we use social media to effectively spread, the message of Get Checked A Tiempo, and kind of use it as a tool to kind of combat misinformation, but also get to people a lot quicker?
Yeah. I think BronxNet is a great idea because a lot of patients and people in general are getting information through YouTube and other channels. Also Instagram and Facebook. I don't even know how many people watch the news anymore. So I think, the highest number of women are getting diagnosed in their 50s and 60s. But you also can be diagnosed before the age of 40. So hopefully with all this, again, the social media that there is now, there is a way to get the message out. And I think this program is super helpful.
Now, when should people begin thinking about their body in this way? As you mentioned, it could happen before 40. So what age do you encourage, women to look at their bodies and start maybe noticing some signs or symptoms?
I think what we say before the age of 40 is to be aware of your breasts. Especially if you have a mass, you shouldn't ignore it. Some of it is just an abscess, a cyst, or something like that, but I would bring it up to your internist, your primary care physician, family physician, gynecologist. Also very important is Memorial Sloan Kettering has a RISE program. It's for high-risk women. So for example, you really need to be aware of your family history. So if your mom or first cousin or sister had breast cancer young, you might qualify for a high-risk program where you can get genetic testing, mammo, ultrasound, MRI, all before age 40. So that's another message to know your family history and seek help.
Now, where can people go to learn more information?
So Memorial's website, MSKCC.org. You can also look at the website for MSK Ralph Lauren Center.
And can you translate that in Spanish for our Spanish-speaking viewers?
Yes, thank you. So para más información pueden ir a mskcc.org o la website de Memorial Sloan Kettering Ralph Lauren Center.
All right, well, Doctor, thank you so much for joining us and having this very important discussion for our community.
Thank you so much for having me.
To learn more about this campaign, please visit the website getcheckedatiempo.com. Stay tuned, we have more for you right after this.
What's up, creative family? Discover your voice with BronxNet community media classes. Are you ready to bring your ideas to life? At BronxNet, we offer television production classes for community members ages 18 and over, empowering you to share your vision with the world. Get certified in field production, in-studio production, and our new exciting addition, podcast production. Once certified, you can create your own show to air on one of our 6 TV channels. It all starts with our free Unleash Your Ideas Masterclass, designed to help you plan your show idea and set you up for success on your production journey. This class is offered at the beginning of each month for your convenience. Our dedicated BronxNet team is here to support, encourage, and uplift you every step of the way. Join us and become a part of the creative force that engages and inspires the Bronx community and beyond. Sign up today and start your media journey with BronxNet. Visit bronxnet.org/education to learn more and register. Let's create something amazing together.
Welcome back. New York City has 40% women-owned businesses, which is more than any other city in the U.S. Although this number is higher compared to other cities, there are still many struggles for small businesses in New York. The founder and CEO of Cupcake Me, Britney Moss, now joins me to discuss her journey. Now, can you tell me a little bit more about your business, Cupcake Me? I love the name. It sounds super cute. So can you tell me a little bit more about that?
Thank you. Cupcake Me is just as you just described it, very fun, very cutesy. But it's definitely a bakery that is striving to be all-inclusive for all dessert lovers. But right now we're also focused on the 4 C's, which is our cakes, cupcakes, cookies, and our super, super popular cake jars, which can be found literally throughout all of New York City right now.
Now, I'm curious to know, do you have a brick and mortar store location, or is it more of an online business?
So we identify our business in a unique way, as far as we have a hub where we bake, which is our kitchen facility, and then we actually distribute through our wholesalers and other small business entrepreneur partners that carry our brand, so it can be accessible to customers online and when they walk in.
Now, what actually inspired you to kind of get into the baking industry?
So I actually have been baking since I was 6 years old. But what pushed me is I have a background in hospitality and food and beverage. And then honestly, it was just me wanting to spend more time with my daughter. And so I was just like, let me just take this leap of faith now. Worst case scenario, I can always come back to what I was doing as a career. But I haven't been back since, and it's just onward and forward from this point on.
Oh, that's amazing. And you mentioned that, it was something that you did as a kid. Can you talk about how you can use baking as a bonding experience for, something that you had as a kid and something that you will kind of take on with your kid as well?
Definitely. It was definitely a bonding experience because my grandmother, who was passed away before I was even put on this earth, she actually baked a lot and helped our community with baking and was able to help other families actually pay for their kids to be able to get supplies and stuff for school. And so my mom passed that on to me as our bonding way of doing things when I was 6 years old. And then honestly, I started doing it with my daughter, and then it just led into a business.
Oh, that's amazing.
So, yeah.
I love to hear that it's like a generational thing. That's amazing. Now, I would love to, kind of hear your background or your story as a business owner, because baking and then becoming a business owner is two different things.
Yeah.
So can you talk about your experience as a business owner and what that has been like?
So as a business owner for the last 7 years, it's a lot of pivoting, transitioning, especially being a business owner during like a global crisis. And so during the journey of pivoting this business to where it is now, participating, having a storefront at one point, and then not having a storefront due to the pandemic, and then going into outdoor food markets with New York City and working with large outdoor markets at like a very large scale, meeting customers where they were to make them aware of the brand, and then now pivoting over the last year and a half into gaining awareness from corporations and partnering with global wholesale retailers. It's like a very, very big journey, but nonetheless, it's there so you can grow the business and actually like profess what you see for yourself, your version of success, and building the mindset of business is honestly what's going to help you scale and grow.
Now, what are some of the challenges that you face as a woman and minority, business owner, here in NYC? Yeah,
definitely. As a women and minority-owned business, there are some like blocks and hurdles ahead of you in the journey of entrepreneurship. But I would definitely say to any like women or minority-owned business is to address it head on and be authentically yourself and stand by your product and what you produce. And also guarantee, great customer service will get you a long way, regardless of being a woman or being a minority. It will get you very far, and people will understand and back you on your brand.
Now, I understand that you were able to get help from the BXEDC, which is like, I love to say it's an amazing program that helps small businesses here in the Bronx.
Yes.
What was that experience like for you?
Firstly, they did a great job in reaching out to me and letting me know that they are, around and well. And then also the products that they offer small businesses is pretty much like, for the Bronx anyway, like a game changer in the sense of small businesses always need access to capital, especially minority-owned small businesses. So to have that there and they walk you through the process and make sure that whatever product they're offering you is actually going to be great for your business and its growth model is like something that you literally can't pay for anywhere else. This is what is going to optimize your success and make sure that you're able to reach the levels that you're geared towards.
Now, I want to take a moment to highlight some of the work that you've done, because I'm looking at it here and it looks so delicious.
Thank you.
And I think that these are one of the things that, like, when you have a hobby or something that you do that you love, you don't think about the business side of it.
Right.
So when you're, designing, these, amazing like desserts, what is going on through your mind? And did you at any point know, like, oh yeah, I'm gonna have to do a lot of paperwork, before I start making these cupcakes?
Yes. So with anything, especially a food product, you want to pretty much make sure that, if you're cooking and you're doing X, Y, and Z and the consumer has to like eat your product, you want to practice safety first, of course, and that involves with, taking your food handler's license with the Department of Health. And so it's a lot that goes on before the customer actually just sees the end product, because you want to make sure you're being safe, you're following rules and regulations. But that's the paperwork side of it. The other side that helps me create the flavors that I actually produce and have customers enjoy is pretty much of just understanding, putting myself in the customer's place. What do I like? Well, how would I want to receive this item? What color variations go into it? And so that's pretty much what goes behind how I do things. And it's all for like the customer to have a great experience on their end.
And what advice would you give to somebody who wants to specifically work, in the food industry, in baking, who wants to, maybe it started out as something they love to do for fun, but they want to take it further?
Yes, I would say definitely to get to the level that I am at today, test your product, test your demographic. Don't be afraid to go out and speak to people. Don't be afraid to give out samples, because you don't want to just be putting out products and they may not be doing well. You want to actually see how people react to them. And definitely like use your network in your borough or in your city or in your town and ask questions. How can you get in front of people? Go to markets. just offer people your services left and right. If you stand by your product, people will notice you, and that will help you in the long run.
That's amazing. And then, what are some ways that maybe if there's something that you're not a huge fan of, because are you somebody who loves eating sweets or?
To be honest, I've never been a big sweet eater. Like I taste test everything, and sometimes I do like binge food, like on what I have created, especially when I'm super excited about it. But outside of that, not necessarily, and that's why most feedback that I get from our product is not overly sweet, but it's super like comforting still as a dessert option. And I love that because at the end of the day, I'm not trying to get people sick. I'm not trying to harm their healthy lifestyle. I just want them to be able to indulge when they see the need to in a great way.
That's amazing. And I love that because there are people who like these things but don't want it to be overly sweet. So I think that it's amazing that you kind of add that layer there.
Yes.
Now, where can people go to learn a little bit more about your organization, or, if they would love to support you, where can they go?
Yeah, they can definitely visit our website at www.cupcakemenyc.com, and also our Instagram at cupcakemenyc. That is our handle for all social media outlets. And if you would like to support us, and keep us in these stores and on these shelves, definitely throughout all the 5 boroughs of New York City, we are available with DoorDash via DashMart, and also we'll be releasing with Walmart online for nationwide shipping to your doorstep in November.
Congratulations
Thank
on
you.
that. Well, Brittany, I want to thank you so much for joining us and kind of sharing your journey with us.
Thank you so much for having me.
To find out more about Brittany's business, please go to her website, cupcakemenyc.com. We have to take a quick break. We'll be back with more Open right after this.
Hey, creative family. My name is Timothy Coleman, and I'm the Director of Education here at BronxNet. And I'm standing in BronxNet's Media and Technology Studios in the South Bronx because I want to let you know about an amazing program that we're bringing back that highlights the creativity of community members just like you. Emerging Media Makers is a show that introduces you to BronxNet's certified producers. They've taken a step in their creative journey by enrolling in BronxNet's media training classes. On this show, you'll get to see the many ways that our certified producers have created a space that's all their own. Emerging Media Makers, your passion lives here.
Welcome back. BronxWorks will host its annual 5K Fun Run/Walk Monster Mash Hunger Dash at Orchard Beach on Saturday, October 19th to raise funds fighting food insecurity in the Bronx. The 5K event will support food pantries held at several BronxWorks locations. Gianna Dell'Olio and Maria Rivera of BronxWorks join me to discuss the event and how you can do your part to combat hunger in the Bronx. I want to thank you both so much for joining us.
Thank you for having us.
Now, it sounds really fun. I'm already sensing like a Halloween theme. Can you tell us a little bit more about, the organization behind the 5K Fun Run/Walk?
Sure. So BronxWorks, we are a social services organization, a settlement house. We've been serving our Bronx neighbors since 1972, so we're over 50 years old. And we provide a wide array of services, programs for children and youth. We provide programs for our older adults, which Maria is our VP of Older Adult Services, workforce development. We do a lot of work to keep people stably housed. We do a lot of work to help our most vulnerable population, the unhoused. We do a lot of work in the community health, right, to try to help the Bronx. One day we're not going to be 62 out of 62 counties. So if you could think of a social service, we offer it, and we provide our services, as our mission says, from toddlers to seniors.
That's amazing. And Maria, I would love to, hear you expand a little bit more about the work that you do with seniors, because when we talk about food insecurity and hunger, we know that it does affect a lot of seniors. So can you tell us a little bit more about the work that you do?
Sure. So I've been working with the seniors for 25 years now. And we started with 4 centers, now we have 10. We offer meals at these centers and activities. However, pantry is very, very important to the seniors. They're able to get food products that help them, make it through the month. So we have over, I think now we have all our centers have a sort of a pantry one way or another, either a small one, grab and go, or full-fledged, pantry, 125, 150 bags. And every month the number grows higher and higher. Especially in the summer months, I think it's because a lot of grandparents have their grandchildren with them. And so we tend to see more and more people at the summer and also during the school breaks. I've been looking and saying it's during that time that we try to do the most bags possible to give to the seniors. So, and they go different places. I see them on the line sometimes very early at 6 o'clock in the morning. So it's very important for them to do. And then we also have meals, so they have meals and then they're waiting to get their pantry. So we've been doing that for a lot of years.
Yeah, and I also want to, mention that although we did, focus on seniors for a minute, unfortunately food insecurity is affecting our entire borough. And there are so many people affected by this, which is why I understand that we are, this fun run is happening.
Yes.
Can you tell us a little bit more about the run? I know when people hear the word run, they get a little bit nervous about that, but what can people expect at the event?
Sure. So the stress for sure is on fun, run, walk. BronxWorks, we had our first 5K, I believe it was back in 2015, as a way to, twofold, right? Engage our staff more, get some of our neighbors out into doing a fun activity, and then also to help raise funds for programs that maybe don't have a sustainable source of funding. BronxWorks, we do receive a significant amount of public funding, but a lot of our programs also really, really depend on private funding and these smaller fundraisers. Obviously with COVID, right, that kind of put a pause on our 5Ks, so we didn't have one for a couple of years, and we brought it back last year. We decided to, do it in October, where the weather might be a little bit cooler, and then also embrace the theme. Many people celebrate Halloween or just celebrate, an opportunity to dress up. And so we had a staff contest last year to help us name the 5K, and so we call it the Monster Mash Hunger Dash. And again, the focus is on fun, 5K, whether you run or walk. We will bring some stopwatches. We do have a couple of participants who are competitive runners, but that's really, really optional. It's however you feel to participate.
And I also want to add with that, it's an opportunity to foster community. Can you expand on how, regardless, however you move, as long as you're moving and you're, part of the community, what does that mean for BronxWorks?
So it means a lot for us to have, participants from all walks of life, right? To really mirror who we are and who we support. So we'll have families join us, we'll have adults join us, we'll have older adults join us. Sometimes they're staff, sometimes they're participants. We have a great group of supporters in the form of our board and our leadership council, which is a non-governing board. So they also come out and support us. So it's really nice to see so many people together in a more relaxed atmosphere. And there's nothing more fun, right, than to see your CEO, our CEO Eileen Torres. She's fabulous, and she totally embraces the theme. So last year, her and her son were dressed up as skeletons, and I think that also disarms people and makes everyone understand. BronxWorks, we are so community based, and it's so important for us to connect with our community members.
Yes, and I just want to add, we have a healthy aging focus in older adult centers now, and we have a walking club. And we started out with 5 or 10 seniors, and now we're up to 33 seniors. So we're encouraging them to join us in the walk. We do walking 3 times a week now, and the numbers have grown and grown. So more seniors are walking. Okay,
I love
so,
that.
yes.
I love to hear that. And I think that oftentimes when we talk about health, just in general, there's always a serious tone, of course, because we're talking about health. But I think this is like one of those opportunities that, where we can make it a little bit more fun. And as you mentioned, kind of like put your guard down and just kind of enjoy being around your community. So I'd love to hear that. And with that, I also want to add that means costumes are encouraged, correct?
Yes.
Absolutely, absolutely. Last year, thanks to my kids, I was a minion, and so that was fabulous. I just love wearing yellow. We also encourage, when we talk about our community members, many participants bring their leashed dogs.
Yes.
And again, there's nothing more fun than to see one of our 4-legged friends participate with their own costume.
Yes.
So yes, costumes are encouraged but not required. Again, we want everyone to feel comfortable and not be intimidated by that.
That's amazing. Now, I understand that there's also an opportunity for participants to actually fundraise for the event themselves. Can you tell me a little bit more about that?
Sure. So, again, when a participant registers for the event, that's great, and we're so happy that they'll be a part of it. But then if they take that extra step to help us fundraise, last year we raised over $20,000. We have a little ways to go this year to match last year, but I know we can do it. There's no requirement, there's no minimum. So, I know it may sound cliche, but no fundraising amount is too small or too big. We have incentives for the fundraisers. So first of all, if you register, you do get your own commemorative BronxWorks 2024 Monster Mash Hunger Dash T-shirt,
Yes.
which you have to get one of those. And then if you fundraise, we have a couple of tiers. So at $300 level, you'll get a crew neck, which is very in right now, everybody and the crew necks. And at $600, I think, you'll receive BronxWorks pajama pants, which again, last year we did hoodies, but everybody loves a good pair of pajama pants.
That's amazing. I love that there's these incentives to help people feel like the work that they've done is noticed and appreciated. So I think that sounds really great. Now, are there any safety measures or any protocols that will be in place for participants during the 5K event, just if that's something that they're thinking about? Fortunately, right, I don't want to say fortunately, things have been pretty quiet, but we'll always follow, our local authorities if there's any health concerns. And as far as the physical, again, there's no pressure on anyone, right? If they don't complete the 5K, that's okay. I'm sure that their supporters will understand that as well. But we will always follow our local partners and make sure that we're adhering to the latest health guidance. That's amazing.
So I think we will finish because we've been, working on that walking for the last, 6 to 8 months. I think we're going to be good.
That's great.
So, yeah,
I love
come
that.
out and see us. See me walking with my seniors. Okay?
She will surely beat me.
Yes.
Now, where can participants go to find more information about the event, including registration, details, and any updates leading up to the day?
So BronxWorks.org, our website, is the hub for information, and the Monster Mash Hunger Dash is right at the very top of the homepage. There's like this nice bright green banner. Mm-hmm. If there's any type of announcement that's like really critical to the day of, or something that we know the day before, we also have the opportunity to put an emergency banner on the website.
Right.
But our website will be the hub, and we'll also share necessary updates on social media, so Facebook, Instagram,
That's amazing.
Twitter, X.
I want to thank you both so much for joining us,
Thank
to talk
you.
about this. It sounds like so much fun. And again, I truly do love to see organizations kind of put that fun hat on and do something that's a little bit out of the ordinary, compared to other days of work. So I think this is amazing. Yeah. And definitely I want to encourage everybody to go out, get some exercise, and have a little bit of fun. But with that, I want to thank you both so much for joining us.
Thank you.
Thank you so much for having us.
The 5K Fun Run / Walk Monster Mash Hunger Dash at Orchard Beach is taking place on Saturday, October 19th. For more information about this event, please go to the website on the screen below. We have to take a quick break. We'll be back with more Open right after this.
.7% of Bronxites currently experience food insecurity. Meanwhile, instead of these nice, colorful foods, this is the best food that they have access to. If this sounds like you, there are a bunch of resources to get healthy food for free or cheap. If you want to help, you might consider donating or volunteering in one of these places. Community fridges like this one are all over the city, and allow New Yorkers to conveniently donate extra food to people who might need it. Go to this link and find your nearest one. Food banks and pop-up events like these provide millions of healthy meals to families in need. These organizations are distributing meals to Bronxites as we speak, and are always accepting donations and volunteers.
Welcome back. Organization Oliver Scholars provides opportunities for young people across New York City to access top-tier educational resources and transformative experiences. The organization currently accepts applications and nominations for their next class of scholars now through January 25th. CEO of Oliver Scholars, Dr. Danielle Moss, joins me to discuss. Doctor, thank you so much for joining me.
Thank you for having me. I'm glad to be here.
Now, I'd love to hear a little bit more about, what inspired the creation of Oliver Scholars.
Well, we are actually celebrating our 40th anniversary. We were founded by a gentleman named John Hoffman, who had attended an independent boarding school himself and saw an opportunity to bring more diversity to his alma mater. So we started with one partner school, and now we have 70 schools within our consortium network.
Now, I want to expand on the 40th anniversary. One, congratulations. I think for any organization to reach 40 years, it is definitely a milestone. Can you talk about the significance, of seeing, being a part of something that has reached 40 years?
It is absolutely astounding. Keeping a nonprofit going in New York City is no easy feat. I think there are about 50,000 nonprofits in the state of New York. And getting people to really focus and support this population of high ability Black and brown students over such a long period of time is a feat in and of itself that, I wouldn't just attribute to me, but we have a wonderful board of trustees. Our alumni are incredibly committed and active, and we are actually celebrating our anniversary this evening at Cipriani's 42nd Street.
That's amazing. And can you, talk about, just the gala, what significance that holds, and, why is it just so important to kind of be around the people, that has helped bring the organization to where it is today?
Well, over the last several months, we've had a campaign called 40 for 40, 40 alumni over 40 years. And we've really been able to highlight alumni who are knocking it out the park in journalism, in medicine, in law, in art, in business, really just to see the trajectory of their lives and how transformative the work of this organization has been for so many young people is absolutely gratifying.
Now, I want to touch on something that you mentioned that is super important, in that there's a focus on Black and brown students. Can you talk about, why that was needed in a city like New York?
I think we can easily kind of recognize the data that say that Black and Latino students, despite decades of progress, are at the bottom of everything in terms of outcomes educationally. And we aren't always serviced in our schools in the way that we deserve. We are really focused on gifted and talented students. Interestingly enough, most of our students have not been identified for gifted programs. Black and Latino students are 20% less likely to be identified as gifted, regardless of their test scores, and a lot of that has to do with bias.
Thank you so much for pointing that out, because I know that, unfortunately, even if, a parent may notice that their child is gifted, they don't always have the resources to kind of take advantage of, I noticed that there's something special about my kid, what can I do? Where can they go to kind of utilize that and, see their fullest potential? How does Oliver Scholars help with that?
So one of the things I love about our nomination process is that anyone can nominate a high ability student. So it can be a parent, it can come from a school, a principal, a church leader, anyone who's interacting and engaging with young people who have high academic ability. Our students have to be performing at a 90% average or above, no grade below a B, and have scored a 4 on at least one of their state exams. And oftentimes, kids are bored, right? They're not being challenged at the level that they deserve. And so we want to make sure that we create a trajectory that matches the competencies of young people.
Now, what are some specific resources and opportunities the program provides to its scholars to ensure their educational success?
So we have a pretty rigorous admissions process. On an average, we'll get 500 nominations from across the city. We're only going to accept 75 students.
Wow.
So the selection process is really intense. That does involve some standardized testing and interviews of the family and the young person to make sure that there's a commitment to our 10-year continuum. And then students attend what we call SIP, or the Scholar Immersion Program. Basically, that's 2 6-week summers and 1 year of Saturday programming. During that time, we're really going to help students to develop a sense of identity, a sense of self. We're going to shore up those writing skills, those comprehension skills. We're going to work on math. We're going to do everything that we can to position them for success at their, elite high schools.
Now, one thing I love to hear was that there were, 500 people, or children, being submitted, because I love to hear that, one, because that means that people are seeing the work that kids are doing, and that means that there's a want and a need to put them in programs like this. But as we know, it is a very competitive, or, it is something that, a lot of people want to be a part of, and unfortunately not everyone is going to have that opportunity. So with that being said, what can you share about the application process, and, what are some tips for submitting a strong application?
So I think, everybody's coming to the table with a great academic record. We want to know that there's a commitment to spending your summer in an academic setting. We are hosted by an independent school in Manhattan, and we do 1 week at a boarding school. We want to know that families are open to the possibility of boarding school. 50% of our high school students are placed at boarding schools across the Eastern Seaboard, but also as far away as California, if you can believe it or not. And then we are looking at test scores, because the test prep that we do is really to prepare our young people for testing that will be required for admissions to independent school.
Now, I also want to add that when it comes to things like these, grades are very important, but it's also about, maybe personality, or, what dreams you have, or what are some things you do outside of school. What are some attributes Oliver Scholars looks for in students that may not be academic?
That's a great question. I think we're looking for leadership potential. Our 3 pillars are leadership, scholarship, and service. So we're looking for young people who have a heart for service to their communities. All of our high school students are required to complete 150 hours of volunteer service. hopefully in the neighborhoods that they come from. We think that's really important because I don't care what fancy boarding school you go to, really to whom much is given, much is expected, right? So we want to make sure that we're building leadership capacity in communities because maybe one of our young people is going to solve, the cure for cancer or some other big, seemingly intractable social issue. So we're really looking for young people who have a heart for service and who show leadership potential.
Now, can you tell me maybe some success stories that you've seen from alumni? It's been 40 years, so I'm sure that maybe that first year there's a student who was in the program that has gone on to do amazing things. Can you maybe pinpoint some students that stick out to you? You don't have to say their names or anything, but what are some amazing things that students have gone on to do since being in the program?
Well, one of the things I love about this organization is that a third of our trustees are actually alumni of the program. They are thriving in private equity, in hedge funds, in medicine. We have an alum who's an actress who's on the board. We have others who are bankers. There's really no profession where you can't find an Oliver Scholar who's doing amazing things.
That's amazing. I love to hear it. And I love that it shows children that there's a range, like even if you are gifted and amazing, maybe there's something that you want to do in the creative world. It doesn't have to always be what we stereotypically think as something that's academic. And I love that because it gives children options. I also want to talk about Kwanzaa Jones and Jose Feliciano, Champions of Excellence. Can you tell me a little bit more about that?
So we were introduced to Kwanzaa and Jose a few years ago at another gala, and this year we are delighted and excited to be able to honor them for their philanthropy. They have a goal to philanthropically touch the lives of 1 billion people, no small feat, and they are folks who put their money where their mouth is. And I think what's really exciting for us on this 40th anniversary is that the honorees reflect the communities and the young people that we serve, because we want them to see themselves in Kwanzaa and Jose.
Now, what do you hope to see for the next 40 years of Oliver Scholars?
I think every nonprofit will tell you, I want to put myself out of business, right? I want to live in a world where every young person of promise is getting everything that they deserve in their schools. But to the extent that we're still around in 40 years and the racial and cultural disparities continue to persist, I want to make sure that we're thriving, that we're serving more students, right? So that if 500 young people were qualified for admission, we'd be able to, create 500 spots.
Well, Doctor, I want to thank you so much for, joining us and discussing the work that you're doing to kind of support our Black and Latino children, here in our city. So, thank you so much for joining us.
Thank you for the opportunity.
To learn more about the services this organization provides, please go to their website, oliverscholars.org. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you miss any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at BronxNet.org. You can catch a brand new episode of Open with Darren Jaime on Wednesday and with Rena Valentine on Friday. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.